Hi everybody, my name is Caitlin. I'm a doctor of physical therapy here at Wellbeing. Today in my blog post I talk all about scars and how scars can relate to dysfunction, especially pelvic floor dysfunction. So I wanted to make a little video to go along with that to demonstrate how scar tissue is formed. So the body lays down a series of collagen fibers in order to close the gap of whatever wound or cut that we have, and that creates scar tissue. So the direction of the collagen fibers that the body lays down are going all different ways. And I have a hairnet to demonstrate that. If you look at the fibers of this hairnet, they're going in all different directions. And because of that, there's not a ton of give to that. It doesn't stretch very well, no matter what way you pull it. So as the body lays down more and more layers of these collagen fibers, it gets stiffer and stiffer. I'm going to show that by folding it, this hairnet. So we have lots of layers of our collagen fibers. And so when you go to pull on that, it does not stretch at all. And that's how we get that hard quality of scar tissue. And so this can create pain and tension and tightness in the area of the scar as well as the surrounding areas. So if you look at this sock, we're going to pretend this seam in the sock is our scar. Let's say this is a C-section scar. And so you can do this at home, grab a sock, feel the seam right there. It's kind of hard to the touch. You can feel a ridge similar to a scar. And so if you try and pull right on that seam, it does not stretch very well. If you pull this way, it kind of gets stuck there. That's similar to how scar tissue is. It doesn't move very well. Unlike up here, it stretches great in all different directions. And that's kind of how our belly is. If it's been unaffected, it should move as we move and be nice and squishy. So with this scar, and our C-section scar that we have, it is tight not only right around the scar, but let's say we try and pull just above it or just below it, it doesn't move quite as well as it does up here. And that's kind of similar to how scar tissue is because of the fascial connections. So you can get adhesions and tightness in the surrounding areas of the scar as well. So your helpful little tip for today is scar massage or scar mobilization. And there's several ways to do it. One way you can do it is just coming back and forth, rubbing up and down all along that scar. We can come rub lengthwise, we can massage, kind of pinch it in between our fingers and roll it in between our fingers. Anything you can do to help get that scar moving a little bit better is going to help overall. If you have a scar, let's say on your abdomen, on your pelvic floor, on your chest wall somewhere, that's maybe limiting your activity level because of pain or limiting movement, please come in and we can definitely help you get back to the things you love doing. Thanks everyone for watching.